Students, in this video we are going to quickly learn about the diseases, and we are going to talk about the communicable diseases and the non-communicable one. So first of all, what is disease? Do you know, student, that what is disease? So disease is a condition, okay, that impairs the normal functioning of our body or mind. Okay, so it impairs, okay, our physical and mental health as well as mental condition or the health. Okay, so when we are fit and healthy, okay, then you know that your body is full of energy. But when there is a attack on your physical or the mental health, then you cannot perform your normal function. Okay, so that state is known as disease. Okay, now disease are of two kind. I wrote it here: communicable disease and the non-communicable disease. The communicable diseases are infectious. Okay, so infectious means, student, they can be spread from one person to another. Okay, and the non-communicable, they are non-infectious. It means it will not spread from one person to the another. Okay, so let's first talk about the communicable disease. Okay, so I already told you that communicable diseases are the one that can be spread from one person to the another. Okay, so it will spread. How it will spread? It will spread from one person to other. Okay, and who causes that communicable diseases? Okay, so what are the causative organism, or what causes the communicable diseases? Then these communicable diseases, they are caused by the pathogens. Okay, and what kind of pathogens? They can be caused by bacteria, they can be caused by the viruses, the fungi or fungi, okay, protozoa, or they can be caused by the parasitic worms. Okay, so these are the different causative organisms that will cause these communicable diseases. Okay, so let's quickly talk about the bacteria. Okay, so bacteria, we all know that they are tiny single-celled organisms. Okay, so they will cause the sore throat, okay, in our body. Viruses, they are smaller than the bacteria. Okay, and they will need a host cell to multiply. So if they are outside, they cannot multiply, so they have to enter in our body. The example here is the common cold or the COVID-19 also. So that's why when the COVID-19 was spreading, it was advised to everyone that you have to isolate, right? So you have to be away from another person, otherwise the virus will find another host to multiply. Okay, then there is a fungi. It will cause the some skin infections. Okay, the protozoa, they will cause, they are single celled organism, and they are often they are parasite, and they will cause the disease malaria. And the parasitic worms, they, for example, the tapeworm, it lives in our body. Okay, and it will cause the disease. So now, student, we understand that communicable diseases, they are spread from one person to another, and it is caused by the pathogens, and these are the pathogens: bacteria, viruses, fungi, protozoa, and the parasitic worm. Now let's talk about the non-communicable diseases. So I already told you the non-communicable diseases, they are also known as non-infectious diseases. Why? Because it cannot spread. Okay, sorry for the spelling mistake. It cannot spread. Okay, from one person to the another. Okay, then if it is not spread by any organism, then how it happen? Okay, how these diseases occur? So this can results from the combination of genetics. Either it is there in your genes. Okay, either it is environmental, in from the surrounding. Okay, your lifestyle. Okay, it can also lead to certain diseases, okay, or the physiological factor, okay. So the communicable diseases include certain chronic diseases, okay. So these develop slowly and it will last for the non-communicable ones, it will last for the long time. For example, heart disease, diabetes, okay. If a person in a family has it, then there are very high chances that their children will also have it, okay. Then there is a nutritional deficiency sometime, okay, like example anemia, it will occur due to the iron deficiency, right. And then the genetic disorder, there is a sickle cell anemia, okay. This has happened if there is a in the genes, if it is present in your genes of the your ancestor, then it is like more likely to happen in the children also. Then there are certain injuries also, like physical harm to the body, burn or fracture, okay. So these are all example of the non-communicable diseases. So students, we have to understand that how the communicable disease spread. So how does spread, what do you think? So the communicable diseases, they will spread through either through the direct contact, okay, or either indirect contact, okay. So the what is direct contact? If you, okay, the direct contact first include person to person, okay. Suppose if you are shaking your hands or touching an infected person, okay, that is having the communicable disease like cold, then you will also catch the cold, okay. The second way is the contact with the body fluid, okay. So the first way was the physical person to person touch, and the second is the contact with the body fluid. So if by mistake you come in contact with the blood, saliva or the mucus, okay, via the mucus will come out through the process of coughing or the sneezing, okay, then also the communicable disease, it will spread to you, okay. And if we talk about the indirect contact, then if you are touching the surface or object that an infected person has already touched, okay, touching infected surfaces, then also you can get the communicable diseases. For example, if there is a person, okay, he has a very bad flu or the cold and he has just entered the house by touching the doorknob, okay, okay, and he has touched the kitchen utensils or some basic things that you are also using, then there is high likelihood that you will also get suffered, okay. The second is the airborne transmission. So airborne, by the name itself indicate that the air is responsible for this kind of transmission. So what happened that the sick person is breathing, then the tiny droplet, okay, due to the coughing or sneezing, it will come out into the air, and if you are passing by or you are sitting or standing nearby, then you will also get the disease, okay. The third is the waterborne transmission. So the name itself indicates that the transmission or the transfer of the disease is caused by the water, okay. So if you drink contaminated water that is contaminated with the pathogen, then you will get the disease also, communicable disease, example the cholera and the typhoid, and then it can spread to the other people also. The fourth is the foodborne transmission. So again the name itself indicate that the disease is caused due to the contaminated food, and you will get if you eat the pathogen infested food, then you will get the food poisoning, okay. And the last is the vector borne transmission, okay. Okay, So for the vector-borne transmission, it will spread by the vector. Example, mosquito. Okay. So female mosquito, when it will bite us, then we will get the malaria, right? So these are the example of how the communicable diseases are spread to us. Okay. Now let's talk about the prevention of communicable disease. How we can prevent the communicable diseases. Okay, so let's talk about the prevention of the communicable disease. So first of all, we have to maintain the hygiene. Okay. So how we can maintain the hygiene? We have to wash our hands, okay, after coughing or sneezing, okay, or after going to the toilet also, before eating also we have to wash our hand, okay. So hand wash is very important. Then we should follow the respiratory etiquettes. So what does the respiratory etiquettes means? So respiratory etiquette means that you have to cover your mouth and nose with a tissue or handkerchief when you are coughing or sneezing, okay. So it will prevent the dispersal of the causative organism, and we have to dispose the used tissue properly also, okay. Then we have to maintain the personal hygiene also. And how we can maintain the personal hygiene? We have to regularly bath, okay. We have to brush our teeth. So our teeth also is the house for numerous microorganisms. So we have to bacteria. So we have to brush our teeth daily. We have to bath daily, and we have to keep our nail clean, okay. So we have to cut them also, trim also, so that they don't grow very long, okay. So first of all, to prevent the disease, we have to maintain the hygiene, okay. The second step is we have to take the vaccination, okay. So what is vaccination, student? It is a process by which a person, it will become protected against a disease, okay, through the administration of vaccine, okay. So vaccination is the process of taking vaccine. So how the vaccine work? So vaccine actually consists of the inactive form of pathogen, okay. So inactive form of pathogen. So suppose I will give you the example of the flu, okay. Suppose there is one organism that will cause the flu, okay. So in the suppose there is a virus, okay. So this virus is causing you the flu, okay. No, it is, if it is present, it will like virus will not, if you it attack you directly, it will not give you disease. It will attack you and then it will multiply, okay, and it will produce a numerous copy of itself, and then you will, when they have the numerous copy, okay, then you will fall the sick, okay. So in the vaccination process, what they will do, they will introduce the same virus that is causing flu to you in your body, but that virus is inactive, okay. It means it cannot cause you disease. So what will happen when they will give you vaccination, okay, that contains the inactive pathogen, okay, our body, it will, immune system, it will recognize that this is the foreign particle, this is not present in our body. In general, viruses are not present in the body, okay. So this virus is foreign to us. So our body immune system, it will recognize it's a danger. So what it will do, it will produce lots of antibodies in our blood, okay, to fight the infection. So we will be protected, okay, from this virus, okay. So in near future, if you get the flu, okay, okay, so now you understand how the vaccine work. So if you take the vaccine, okay, so suppose you take the vaccine, you don't have any flu now, right? You have already taken the vaccine. So your body knew that it has to produce the antibody, okay. So now if from your surrounding, okay, by different method, you already understood how you catch the communicable disease. Now if you catch the flu, the body already know which antibody to produce. So initially when the virus will attack you, immediately your body will produce the antibodies against those flu, okay. So you will be protected, okay. So this is how the vaccination work. So what are the benefits? So why we have to take the vaccine? Okay, so because it will prevent serious illness. Okay, sometimes serious illness, student, it can lead to certain disability or death also. Disability means your one of the body part or something like this, it will suffer and it will stop functioning also. So, or we can die also. For example, in the case of COVID-19, we all know that. Okay, so that's why the government, they have given the vaccination to the people to prevent the serious illness. Okay, so vaccination, it will protect the individual and community also. So communicable, individual and community protection. So why individual and community protection is needed? Because communicable diseases, you know so far that it can spread from one person to another person. So suppose if a person A has it, okay, and if he gets the disease, okay, and suppose there is a B person also, and this A person has not taken any vaccination, okay, and B has taken. So if A is sick, and he can infect the B also. However, the B has already taken the vaccination, so he will get infected by the flu, but he will not fall seriously ill, right? Because he has vaccination. So that's why it is not about one or two person. The vaccination will give the individual also the benefit, okay, and it will give the protection to the whole community also, okay. And there are example also that led to the eradication. The vaccination has led to the eradication of some diseases like polio. So nowadays there are almost no cases of the polio in certain regions of the world because of effective vaccination protocols, okay. So that's why student, it is very important that we have to ensure that we have to take the vaccination, okay, at a scheduled time, okay. So now I already told you about the hygiene. The hygiene is the practice that promote the cleanliness, okay, and the health. And apart from this, we have to do the exercise also, okay. The third one is the exercise. So what is exercise, student? We all know this, okay. So exercise is the physical activity. Now what kind of physical activity? The physical activity that is structured, okay, repetitive means you have to do it again and again, like on daily basis, and purposeful, so you have to have a purpose for it, okay. Okay, so this will lead to the improvement or the maintenance or one of the more component of the physical fitness, okay. For example, running, jogging, okay, cardio, doing cardio. So these are the example of the exercises. So what are the benefits of the exercises for the health? So the exercise, it will strengthen our immune system, okay. It will make us strong. If our immune system is strong, it will make immune system strong, okay. So if our immune system is strong, then we will not fall sick very often, okay. It will strengthen our immune system, making the body better able to fight off the infection, okay. And the second is the exercise, it will also lead to the healthy weight, okay. So neither you, if you are doing the exercise regularly, then neither you will be so thin and neither you will be fat, right? So it will maintain the healthy weight. It will increase our, it will improve our heart health also. It is, exercise is very good for our heart health also, as well as our mental health, okay. Okay, and it will boost our moods and reduce stress also. It will strengthen our bones and muscles also, and in general, regularly, moderately, okay, moderate in exercise, okay. So moderate intensity exercise is generally suggested for 15 to 30 minutes per day, okay. So students, it is very important that you have to do exercise daily, okay. The fourth way to prevent the communicable disease is, of course, taking a adequate rest. So adequate means enough rest. So student, you have to remember that you have to take the rest. So why taking rest is important? Because it will allow our body to repair. So body need rest. Why it need rest? To repair itself. So whenever you are sick, so doctor will tell you to take the rest, because our immune system will act on and it will repair our body itself. Okay. So what are the benefits of advocate rest? It will strengthen the immune system. It will improve our mental alertness. It will reduce the stress. Okay. And it will support the growth and development also. So we have to student sleep around 8 to 10 hours. Okay. A day. Okay. This is for the adult. It should be like 7 to 8 hours are enough, but for the kids, because they are highly active, so their body also need adequate rest, so it has to be 8 to 10 hours. Okay. Now let's talk about the posture. So our posture also, it will prevent certain diseases. So what is posture? So posture, we all know, it is the position in which you hold your body. Okay. So how you hold your body? When you are standing, okay, sitting or sleeping. Okay. So so how you hold your body position, okay, is known as posture. So why it is important for posture is important for your health? Because it will prevent the muscular and the skeletal problems like back pain and neck pain. Okay. So kids, you are just generally suggested by your parents or the grandparents that you have to sit properly. Okay. So why? Because it will prevent your back pain, neck pain, etc. Okay. And it will, if you have a good posture, it will support proper breathing as well as the digestion. So it is very important for breathing. You cannot breathe properly if you are not in a very good position. Okay. And digestion. So see, this is the small thing, but it will make a big huge difference in the digestion also. And last but not the least, it will contribute to your personality. Okay. Okay. And confidence also. So suppose student, if the person does not have very good posture, like he's not standing straight, he's bending, he's bent, he has bent neck, okay, bent shoulder, then does he look so good or does he look so confident? No. So it is very important that you maintain a good posture. Okay. So how to maintain the good posture, students? So while you are standing, you have to keep your head up. Okay. Okay. So how to maintain the good posture? Suppose student, if you are standing, then what you have to do? So you have to keep your head up. Okay. Shoulder back, chest out, and abdomen tucked in. Okay. So this will distribute your weight evenly on both the foot. Okay. So this should be a good posture when you are standing. Now let's talk about the when you are sitting. Then what should be your ideal position or good position? Then you have to sit upright. Okay. Okay, your back should be supported. You should not slouch. Okay, you have to sit straight and the feet should be on the floor. Okay. So this is the best sitting position. Suppose the third is when you are lifting any object. Suppose there is something falling on the floor. Then what you will do? What is the best posture? You have to bend your knees. Okay. You have to keep your back straight. Okay, so this will, when you are picking a heavy object, this will avoid twisting your body, okay, while lifting, and it will prevent the any jerk to your body. Okay, this will not give any pain to your body. Now, very important, students, what should be your posture when you are sleeping? So when you are sleeping, you have to choose a comfortable mattress. Okay, I already told you that a good rest, adequate rest, is much needed for prevention of the disease. So you have to choose a very comfortable mattress as well as the pillow. Okay, so why these are very important? Because they will maintain the natural curve of your spine. Okay, so if it is well maintained, then your body posture will be stay good, right? Then you can just avoid the chances of having muscular or the skeletal problem. Okay, so these are the four I told you methods, okay, for maintaining the good posture. So student, in this video we learn what are the different types of disease, how they can be spread, okay, and how by adopting the healthy habit we can significantly improve our overall health and well-being. Okay, thank you for watching the video, students. Have a good day.